Hi, Dr. Harrison here, and today I want to discuss the topic of sciatica. A lot of people will come in and they're confused about sciatica, and I say that facetiously because it's kind of funny. They'll just come in and they kind of point to their butt area and they say, "Oh, I've got sciatica." Well, there are a lot of things that can cause pain in the gluteal area, and unless that pain is running all the way down the leg to your foot, you probably don't have a true sciatica. So let's just talk first about what sciatica is, and then we'll talk about the common conditions that might mimic what my patients seem to think sciatica might be or is sometimes. So sciatica is the largest nerve in your body. Basically, it's a joining together of all of the lumbar nerve roots. So in your low back or lumbar spine, on either side of the vertebrae, you have nerve roots that come out. And there are 5 vertebrae in that low back. So we have multiple nerve roots that come out and they join together and form that large sciatic nerve, and they travel through the buttock region, down the back of the leg, down to the foot, and they're giving branches off to the muscles, blood vessels, and ligaments all the way down to the feet. So typically when you have a true sciatic problem, which is going to be an irritation of one of those nerve roots, usually in the lumbar spine or low back, or it might be a clamping down of that sciatic nerve in the buttock region due to muscle contracture, you're going to have pain all the way down to the foot. That would be a true sciatica. If the pain doesn't travel beyond your knee, typically we're going to find that that pain is being referred either from the joint, and that would probably be your sacroiliac joint. The sacroiliac joint is the joint next to your tailbone, and you've got one on the right side and one on the left side. So you have your tailbone, you have the 2 innominate bones, or your what people call their hips when they rest their hands on their hips. Those innominate bones kind of wrap around and they attach to the sacrum, and where they attach to that tailbone or sacrum is where your sacroiliac joint is. Well, those sacroiliac joints are mobile joints, and those innominate bones kind of pivot around them as we walk. Well, for people who sit too long, or maybe they lift something improperly, what happens is those sacroiliac joints can lock. And when they lock on one side or the other, the opposite side usually will start working overtime. People will get pain in the buttock region. They might get a referred pain down the leg, usually on the side opposite of where the restricted movement is. So what we do for those patients, we get in and mobilize that restricted joint, and the opposite side doesn't have to continue to work so hard, and it will calm down. The muscles start to relax and the pain just goes away. That's your typical sacroiliac problem, and you have to be very specific with where we create that mobility and making sure that we're hitting the side that's restricted. Otherwise, people just don't respond, and I see that a lot. People will come in and say, well, I went to another chiropractor, or I went to my medical doc and they did this and that and the other thing. Well, unless you get real specific in checking that mobility and mobilizing it specifically where it's restricted, we just don't see a relief in symptoms there. So very, very important. And that's a big distinction between a sacroiliac problem and a true sciatica or sciatic problem. Is pain typically with the sacroiliac problem doesn't travel below the knee, and the pain is on the opposite side of where the problem is. In a true sciatica, you're going to have a nerve root irritation in the low back, and usually that's going to be due to either a disc bulge or herniation, or maybe a subluxation, which means one or more of the vertebrae has shifted in the lumbar spine, and it's irritating one of those lumbar nerve roots, creating that sciatica where we have pain all the way to the bottom of the foot. So if you want to get checked out, if you're having low back pain, leg pain, whether it goes beyond the knee or not, that's something that I can definitely help you with. We just need to make sure, is it a sacroiliac problem or is it a true sciatica? And I hope this video has cleared up some of those misconceptions. And if you call the office, we'll set up a consultation. The consultations are always free. We'll see what we can do to get you back on your way to health. I hope this helps, and we'll see you next time.